the treatment plan for someone with dementia is very individual. No two people have the same course with a dementia, whatever the underlying diagnosis might be. So you're looking at treating underlying conditions that might make things worse. You're looking at whether treatments, so there are medications for dementia that don't cure but treat. So you look at starting people on appropriate medication. At the early stages, you're also looking forward planning, like getting an enduring power of attorney in place, getting a will written, going on that world cruise you've always talked about doing, those things. If the person's a bit later in the dementia, you'll also be looking at things like what we call psychological and behavioural symptoms. So things like anxiety, depression, psychosis, poor sleep, agitation, aggression sometimes, those kind of things. So it does depend on the stage of the illness.
Big part of the treatment, medications do come into the treatment of dementia, but a big part of the treatment for dementia are things like ensuring that physical health is looked after. So that will be things like making sure that the person's blood pressure is well controlled if they have high blood pressure, so there'll be medications prescribed for that. There are a lot of people over the age of 65 who would be on blood pressure medications, making sure things like cholesterol are well controlled, ensuring that the person is active. So this doesn't have to be running a marathon every day now. This would just be gentle walks or swim, which is a non-impact exercise, which is excellent for people of older age who might have brittle bones, and it keeps joint flexibility as well. So a lot of the kind of physical health issues and exercise. Another part is ensuring that the person has social contacts, and by that I mean visits from family, visits from friends. There are things that a person can get involved with in the community. So there are things like memory cafes. If a person felt like they wanted to do some volunteering, there are opportunities for that. There are a lot of active age retirement groups around the country. So keeping the person involved in their community, keeping them active and meeting as many people as possible would be a key part of it as well. It's really about supporting the person living with dementia. It's allowing that person to still be them. They're not defined by this diagnosis. And making a couple of adjustments in that person's life can make a very big difference. So just allowing extra time for things, sometimes memory aids around the house. This would be where if you were engaged with a memory service or with a psychiatry of later life service, occupational therapy would come in there around some of the practical supports. And then the specific medications that are used in the treatment of dementia, aside from the physical health ones, would be a group of medications that we call cognitive enhancers. Now, they cannot cure or reverse memory decline, but what they can do is slow it down. So there are a couple of options there, and these would all be discussed once the diagnosis is made. These would be discussed with the person and with their family around what their particular option would be and what their preference would be around those particular sets of medications.